Hi, this is Dr. Bob Dannenhoffer. I'm the Public Health Officer for Douglas County, and this is our COVID conversation for December the 9th, 2021. As we were getting into December, we were hoping that we would have quiet time and not much to talk about, but unfortunately, we have a lot to talk about, so we'll try and get through that as best we can today. Our guest was not able to make it today, but we'll try again next week. So we'll start today with questions and with the world situation, the local situation, and new things that are up with COVID. So if you have questions, please send them to us at Facebook questions at douglaspublichealthnetwork.org, and we will try and get to those questions as soon as we can. As always, we usually start at the world level and then move down to the local level. At the world level, we're clearly seeing another surge of COVID. When you look at the case counts by day, it really looks like a sinusoidal curve, up and down and up and down. And we are now in the midst of our, depending on how we would call it, fourth or fifth wave. Most of these cases are in the northern hemisphere. So the US is seeing an increase in number of cases, which we'll get to. Europe is seeing a big increase in cases, and Russia is seeing an increase in the number of cases. These cases in the northern hemisphere are almost all still Delta. So the Omicron, while it's arrived, is not responsible for the big increase in cases. Most of these are Delta. And with Delta, they're quite contagious and quite serious, leading to lots of hospital tie-ups and hospital real capacity issues in much of Europe, and we're also seeing that in the U.S. These cases are mostly among the unvaccinated people, and the deaths are almost all among unvaccinated people. So in Germany, Austria, the UK, Ireland, we're seeing lots of cases. Because in those areas, most of the older people are vaccinated, we're not seeing the same huge number of deaths, but we're still seeing a lot of deaths in those areas. In the US, we're seeing an increased number of cases, especially in the northern parts of the US. So Maine, New Hampshire, Vermont, upstate New York, Michigan, Minnesota, Wisconsin are all seeing an increased number of cases. And as the weather cools, we're starting to see those increased number of cases move down now to Pennsylvania, Ohio, Indiana, and Illinois, where we're seeing an increased number of cases. The places which are quiet right now are places like Hawaii, which has a low number of cases, and Florida, which has a low number of cases. Now, Florida has a low number of cases because they have both a high vaccination rate. Well over 70% of the people in Florida are vaccinated, and they've had a lot of disease. So they've had actually more disease than Douglas County. So they have a combination of a high vaccination rate and a high level of disease, giving well over 90% of the people in Florida some immunity. So the number of cases they're seeing is low. In the other areas that I've talked about where they're having a lot of cases, they may have a high vaccination rate, but they've not seen a lot of disease in the past. And so they're seeing a moderate number of cases. Oregon's number of cases is clearly up. There's always a problem after a holiday week and looking at the numbers, but we're past enough the holiday week that we're seeing a definite increase in the number of cases and an increase in the number of hospitalizations in Oregon. So we're worried about that. Most of the disease in Oregon is, again, east of the Cascades, although we're seeing a creeping number of increased cases west of the Cascades in Coos County, Jackson County, and sadly in Douglas County. So Douglas County is also seeing an increased number of cases. It's hard to tell with the holidays because we saw a decreased amount of testing and a decreased number of cases, but now we're seeing clearly an uptick in both of those areas. Many of the tests we're getting are home tests. And so one of the questions we've had this week is, why is the number of presumptive cases going up? So in the past, if you had a home test, we weren't quite sure how to do this. So we left that as a suspect case until you had a test at the lab. Now we've recognized that those home tests are accurate enough that if you have a positive home test, it's considered a presumptive case. If you have a positive test at a lab or a doctor's office or a hospital, it's considered a confirmed case. So the number of presumptive cases is coming up because the number of home tests is going up. That's a good thing, I think, because it increases the ability for testing. But overall, the number of cases going up. And the cases we're seeing are at workplaces. We're seeing cases in long-term care facilities. We're seeing cases at schools, and we're seeing cases associated with the holiday. The cases associated with the holidays seem to have all the same story. Somebody came to the party, they were sick, thinking it was just allergies, and really it was COVID, and they gave it to everybody at the party. So again, if you're sick, please stay home. In the first few days, COVID really looks like a cold. You've got a little runny nose, a little sore throat, maybe a little headache, but not a lot of other symptoms. And people are attributing this to allergies or to cold. And then a few days in, they're getting sicker. They get tested and they find they have COVID. The problem with COVID is you're most contagious on the day before you know you have symptoms, but obviously you don't have symptoms, but on that first and second day. And so many of our outbreaks have the same kind of story. There was somebody that was at a party at a workplace and they were a little sick, thinking it was a cold. A few days later, they found they have COVID. Now everybody's got COVID. So we've got a big outbreak in the jail, largely associated, we think, with that kind of story. So it's really out there. So if you're sick, please stay home. If you're still sick a day or two later, please get tested. And we think that's the best thing you could do. The other thing that we've seen is that the vaccinations seem to be really quite effective. Again, 60% of adults are immunized in Douglas County. Yet, when we look at hospitalizations, overwhelmingly the people in the hospital are unvaccinated. When we look at deaths, again, the great majority are unvaccinated. And when we looked at boosters, almost none have been boosted. So that we know that vaccine is good for you, but vaccine with a booster really does give you increased protection. And especially we think with the Omicron. So Omicron is the new variant developed in South Africa. Those of you who've been watching this for a while know that I've been worried about Africa for months now, because Africa is largely unvaccinated. Lots of densely packed cities and a lot of immunosuppressed people, because there's still a lot of AIDS in Africa, and many of the people are not treated. So immunosuppressed people, we know, are the kind of people that can breed mutations. And we think this is probably what happened in South Africa. So the new Omicron variant is there. This new Omicron variant is interesting. It seems to be really very contagious. So to outcompete the Delta, you have to be more contagious than the Delta, and it appears to be. Some of the stories of rapid spread are really quite amazing, when we have one person getting it and then basically infecting everybody around them. The second question is how severe it's going to be if you get it. This is the good news. The good news is it appears to be probably less severe than Delta. So what we saw in other areas when Delta came to a community, that Delta would come to a community, there'd be a lot of cases and a rapid increase in the number of people who are sick requiring oxygen. With what we've seen with Omicron is a rapid increase in the number of cases, but not an increase in hospitalizations or people requiring oxygen. So at least the initial data suggests that it may be less severe, but we're really going to need to see what happens with this. When we look at cases of Omicron in the United States, most of those cases have been mild, but most of those people have been vaccinated. So it's a little hard to know how serious it's going to be. The third question with the new variant is how well does previous infection protect you? How well does vaccine protect you? And how well will the antibody treatments work? Well, the initial data from South Africa suggests that previous infection will not protect you very well, because when they looked at people who were previously infected, many of them got infected with the Omicron variant. The second question is how well does the vaccine protect you? We don't know that either. Pfizer came out with some data yesterday that suggested that 2 doses give some protection, but the 3 doses give you very good protection. That would be great, because everybody now is eligible for boosters, and we've got plenty of boosters around. So we would really encourage anybody who's gotten their first dose to get their booster. And if you've not gotten your first series, please go ahead and do it. We have vaccine available in many places in the county, at all of the big clinics, at some of the pharmacies, and there's going to be an event this weekend at the fairgrounds where they're going to be doing COVID vaccine, and they're going to be doing first, second, or third doses. So if you need a COVID vaccine and you haven't had a chance to make an appointment, please go to the fairgrounds this weekend and get your vaccine. Other things that are out this week is there's a new drug called molnupiravir. Molnupiravir is an antiviral drug. It's working its way through the FDA process. We think molnupiravir is going to be a good drug. We think it's going to be able to decrease the amount of hospitalizations in people who are at moderate risk of COVID. It looks like about 30% effective. Well, 30% is not 100%. It's still better than nothing. And it seems to be relatively safe and effective. So we're we're awaiting FDA approval. We think this is a drug that you would likely just be able to pick up at the pharmacy, so relatively easy to use, as opposed to the Regeneron, where you actually have to go to a clinic and get injections of the antiviral treatment. The other things that are out this week are that there's new data on boosters for people in the U.S., and it shows that the boosters really do seem to be very effective, especially for older people. And so for anybody 65 and above, you really should get a booster. For anybody less than that, we're really strongly recommending it. But clearly for those of us over 65, we really need to go out and get our booster shots. So that's what we got for this week. If you have any other questions, please send them to us at Facebook questions at DouglasPublicHealthNetwork.org. Again, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County. Thank you.